Hi, I'm Dr. Jeffrey Antimarino from Bellissimo Plastic Surgery and Medi-Spa. Welcome back to our monthly live Facebook program. Tonight is going to be very special. We have a special guest here with me tonight. Tonight's topic is mommy makeovers, and I have with me Michaeleen, who is a patient of mine who has undergone a mommy makeover. So tonight, as we discuss mommy makeovers, why we call it that, what's entailed, Michaeleen's going to give her version of what it was like for her to go through the procedure, what it was like afterwards, how long did it take her to get back to exercise and all the other activities. So feel free to type in any questions you have for either myself or Michaeleen, and let's get started.
Thank you for joining us. We're so excited to have you here tonight.
Thank you for having me.
Well, why did you decide to get a mommy makeover?
I think I've decided, and I'm just like anybody else, I think everybody will probably feel the same and can relate that as your kids get older, you find things you don't like about your body. Of course, everybody knows kids ruin your body basically at some point or another, something. And you find something you don't like that may bother you. So it was just time for me. It was time for me to do something for me. And it was a good time financially and also because my kids are older. So not that that matters, but in my situation, it was good.
At what point did you know when you went in for a consultation that you were interested in a mommy makeover, or were you going in for something else?
I didn't even realize that was such a thing, like that it was called a mommy makeover. My original intentions were to go in just for the tummy tuck. That was my main problem, you could say, that it bothered me the most was my stomach. Of course, having 3 children, large children, lots of extra skin and stretch marks, couldn't get the belly tight. That was my original thought, go in, have the tummy tuck. Of course, I wasn't very large chested either, didn't bother me as much, but thought, I'll ask you why I go in there. And I don't know if you remember when I came in, I had seen a procedure where they were injecting fats into the breast because I was so concerned with the safety of implants and are they safe or are they not safe. And you had said that wasn't really a good procedure for the breast. Maybe other areas in the body they inject fat, but talked about the implants, the safetiness of the saline versus the silicone, and it's turned into the mommy makeover.
Right.
So, Dr. Antimarino, what exactly is a mommy makeover procedure, since we keep referring to it?
Well, classically, it was a name given to a procedure or a combination of a procedure that was going to basically restore a woman's body to a pre-pregnancy form, and that entailed obviously the breast and the abdomen because those are the 2 areas that are hit the hardest. But as it has evolved, it doesn't really, you don't have to be a mom to have it, and you don't have to only just do what was classically a breast augmentation and a tummy tuck. There's other combinations, so it really means what procedure can you put together for the core. So you could either do breast augmentation, a breast lift, could be a breast reduction, could be a combination of a mastopexy or a breast lift with an augmentation, and it could be liposuction of the abdomen, it could be a combination of liposuction and a tummy tuck, or a tummy tuck by itself. So any of those combinations, so it's really kind of grown over the years, and any of those combinations can be considered a mommy makeover.
So do you, after evaluation, decide which procedures to include? How do you know? Is it based upon their physical exam?
Yeah, well, it really starts with what the lady's desire is. And so a lot of ladies, like Michaeleen, comes in and has one main concern that she wants to discuss, but there's always maybe something else that was sort of secondary. And I think once you kind of break the ice and the lady feels more confident and comfortable with you, sometimes she'll bring up, well, what about this since I'm here? Can we talk about it? And that's kind of how it goes about. I think now mommy makeovers have gotten a pretty good name and a lot of marketing. So some ladies will come in and actually say, I'm here to talk about a mommy makeover. So I think depending upon, it starts with me when a lady starts saying, I usually start with the question of, what can I do for you today? Or how can I help you? And then she'll start listing maybe a couple of things that bother her, and at that point, I go through an exam and seeing what the lady's breasts, if she has a little bit of sagging, loss of volume, skin quality, and the same thing with the belly. Does she have a little bit of resistant adipose tissue that you can't lose? Is it mostly just some excess skin? Are there stretch marks? Where are they? And then we sort of put together a plan that's really individualized to her.
Michaeleen, why did you choose Dr. Antimarino to do your mommy makeover?
Well, I saw Dr. Antimarino when I turned 40. That was to be the big 4-0 gift. And he was with another practice at the time. Of course, had a good rapport, trusted you right away, but financially for our family at the time, it just wasn't going to happen. So I guess it was always in the back of my mind. And then just when it was time, I searched you out again and found you and came back. So I mean, we had a history. I mean, as far as I had seen him years ago and then came back again like 5 years later or 4 years later.
Did you have any concerns or misgivings?
I had none. I was excited and really excited that procedures like that could be done to help something that just could never be fixed stomach wise. Just like you said, that last little bit, or the skin and the stress, you think in your wildest dreams, like, how do I get rid of this? And you could actually do it. So I had no concerns or misgivings whatsoever. I was excited about it.
Yeah, and I think the big thing with that is, a lot of ladies are getting back to the gym and really working out, and then they realize, especially for the belly, that little pooch at the bottom that's being sort of stretched out because that's where you carried the child. That gets stretched out, the muscle wall gets a little stretched out. And even with all the exercising, the eating healthy, all this stuff, I think it can be really frustrating and trying to you psychologically as a lady that you can't control that. And skin is not affected by exercise. And a lot of men my age are starting to see that with the aging of the face. It just doesn't matter how good a shape you're in. And so when you come in and we talk about it, and then you realize you can actually put together 2 separate procedures into one and get it all done, one downtime, one procedure. It works out really well.
Yep. How can someone prepare for a mommy makeover? Is there anything that you would suggest they do? Besides diet and exercise, is there anything else that you recommend a woman do?
I think the biggest thing is that she gets back to maybe some light exercising. It's not like you have to go out and run marathons and do the high intensity training and CrossFit. But I think getting back into some exercising, some movement, and kind of let your body get back to normal after pregnancy. But it could also be women that just maybe not even have gone through pregnancy, but have lost weight or through an aging process. So I think you can try to get into a shape that is healthy for you, and then at that point come in and be evaluated.
How was your recovery after the procedure?
It was good. I had no problems, no issues. It was actually kind of easy, but difficult at the same. I would say the first 5 days are difficult for me, in particular because I've had, not only did I have, which I didn't mention before, the breast augmentation, the tummy tuck, but I also had some liposuction. So I also was sore back here and on the insides of my thighs. So that's a lot of areas to be sore on. So the first 5 days were difficult just to move, getting up, because I couldn't really use my arms, and you can't use your stomach.
What did you refer to yourself as before?
Do you really want me to say it? I felt like a turtle on my back, okay? But really, it was I did not take any pain medicine. I did not have to. It may be for somebody else if they need it. It was easy though. I really had no problems. I think I healed quickly. It was fine. There's really nothing I can say other than, just those first 5 days, I would say until you go back to that first visit, that
Right.
visit.
Yeah, because some of the dressings can be bulky, and you have drains for the tummy, and those little rubber tubes are suction balls, and so you kind of have to keep those attached to your dressing. But most ladies complain not really much of pain. They describe it more of a discomfort and tightness. The belly's tight, the breasts feel tight, because the muscle. I always put my implants under the muscle, so the muscle spasms a little bit. And so you feel that tightness in your chest as well. And as like Michaeleen says, when you try to push up to get out of bed, and you don't realize until you either pull a muscle in your abdominal wall or you have that procedure, how often you use your stomach muscles. So once you get up and moving, though, it feels pretty good.
Sorry, I didn't mean to interrupt you, but also because of how tight the stomach is, you actually can't stand upright for the first. Well, I think,
the first 5 or 6
honestly,
days.
I'm just gonna. I did come back to that appointment almost standing upright, and you were very shocked, I must say. But honestly, it's kind of tough. So you're kind of walking around like bent because it's so tight and everything is pulled so tight. But it's a good feeling too, because you just can't believe how nice you look and how tight everything is, considering what has been done to your body with pregnancy or weight gain and weight loss, whatever your story is. So other than that, I thought it wasn't a bad recovery at all.
Yeah. Well, one of my favorite times after any surgery is getting the dressings off of patients, but I really love after doing the mommy makeover, and you take the dressings off, and then you can stand in front of the mirror and see your belly and your breast for the first time. And I would love to look at the lady's face, because it's like Christmas Day. And because it's a completely different look, right?
It is amazing. It's that's what I said. You just can't believe that something can be done for what you think is such a huge problem on yourself, and it's amazing. It's just, I don't know what else to call it. It's just, you can't believe you really did that. It's like you got rid of that, or you changed that, or you made it whatever. It really is. It's amazing.
Is a mommy makeover procedure done in a surgery center, or is that done at the hospital?
It can be done in either place. I generally do mine in a surgery center, and the hospital is also a place you can do it. So those are the two places. I like to use a surgery center. The surgery centers that I use are fully accredited. I use the team is really, for the anesthesia team, is a board certified anesthesiologist, certified nurse anesthetist. We have an RN in the room. We have certified scrub tech. So everything is done, with safety in mind all the way across. I have somebody taking care of the anesthesia. I don't have to worry about that. I can concentrate on what I do. So it's nice to have that, and I think that as we go through this, those are some of the things that you need to look for if you're thinking about having this procedure done. It's always important, and we'll get to that in a bit, how to choose the surgeon, but again, who's giving you the anesthesia and where are you being done. But you got to make sure that those places are accredited and certified.
Something about, do you want me to talk about it later or now? When you asked me about why I chose Dr. Antimarino, the first time when my big 4-0, I did see other surgeons. So would you like to hear that story? Or
Absolutely.
So back to why I chose you, even after I had seen the other surgeons, and it definitely came back to you, you get a feeling. You just know as a woman the rapport you have, and most of the surgeons are male, and it is an awkward thing to come in and point out your flaws. It makes you feel horrible, but if you find that you have a good rapport and you feel comfortable with the doctor, you're more apt to go back or say, yes, I want you to do. Plus, I just, you can read your bio and see that you're more than qualified to, you're a great surgeon. So I would say that mainly was why I followed you back.
Well, I appreciate that, yeah. I think that that's important. It's one of the things that we've talked about in the past is, no matter who you pick as a surgeon, it's got to be somebody that you feel comfortable asking questions, especially if you're having a concern in the middle of the night, on a weekend. Times when you don't want, you don't think you want to bother the surgeon, but if you're having a question about something, you should feel comfortable asking those questions, and it's about your body. So any question is okay, and that surgeon should feel comfortable, or making you feel comfortable to ask it, and they should be able to answer it for you.
I mean, one of the other surgeons even went as far as picking out things that I didn't ask to have done. So pointing out other flaws on my body, not a good thing.
Yeah.
That, I was gone out of there like, thank you very much. I don't need to be told what else needs to be done on my body. But yeah, I definitely agree. And I have to say that you did give me, well, you probably give all your patients, your assistants and yourself, your phone numbers in case I had any questions or problems, which was really cool of you, because who wants a bunch of patients bugging them all the time?
Yeah,
but I mean, so
important.
I felt like if I needed to, I never needed to, honestly, because I had such a great recovery. But if we ever needed to, I could call you at any time, or your assistant. So that is actually a really nice thing that you do.
I think it's important as well, and I want patients to feel comfortable that they can call me, and so all of my patients do have my cell phone number. I know it makes a lot of my colleagues.
It just sounds so funny, like I have my physician's number.
Over the years, and I've been doing it that way for 17 years now, and it's always my patients are very respectful of it.
Yeah,
But I want that rapport with my patients that we do walk through it together, and I'm there, and if they have any questions, it's usually pretty quick, easy.
It is really nice, because it is difficult when you're having a problem and you need to get in touch with your doctor, and you're having to go, well, the secretary, let me get your message into Dr. So-and-so, and you're waiting.
The answering service.
Yeah, right. And so it is really nice to have that. And
Don wants to know, have you had many complications with your patients with a mommy makeover?
It's a good question, and the biggest, probably the biggest issues I've had with the mommy makeover is something which is the most common problem with a tummy tuck, is a seroma, which means that you get a little bit of a fluid collection. Sometimes with the breast, sometimes you can have a malposition of the implant where it doesn't heal in the right spot. And you might need a minor procedure then to go back in and put the implant in the proper position. It doesn't happen very often. Both of the procedures have a low complication rate. So those are the things. The things that I usually quote to patients when I talk to them is, the three things that people most are concerned about when they think about any type of surgery: bleeding, infection, and anesthesia risk. The risk of bleeding after a surgery like this is less than 1%. The risk of infection is also less than 1%. I do give postoperative antibiotics. Some people don't, and that's sort of the surgeon's choice. Also, the risk of anesthesia, and it's funny because more people worry about that than any bleeding or infection. The risk of anesthesia is really about 1 in 1,000. It's very small.
I think my excitedness outweighed all of that. I really, and plus I was a healthy person. Maybe had I had some health issues, you may be a little more concerned. But I was a healthy person prior, so I knew that there should be no complications. But I was just way too excited to worry about any of that.
And that's usually how it goes. It's the problem rate is very small.
What is the Kelly writes, what is typical recovery time, and how long are you limited from exercise?
I'll give you the doctor's version, and Michaeleen will give you the patient's version. Recovery time, I usually, because of the tummy tuck, and like I said before, you use those muscles so much for just about everything you do: walking, standing, twisting, coughing, sneezing. I usually tell you I'd really like you to do not much of anything for the first 2 weeks, and try to get the drains out. The first one comes out usually at the first post-op visit, 4 to 5 days. The second one usually comes out a few days later. So within a week to a week and a half, both drains are out. You're in a compression binder on your belly for about 2 to 3 weeks, and then we kind of transition you into some compression garments. I don't let anybody start exercising for 3 weeks, and then that's pretty standard. Even if you do the combination of the breast and the belly together, the combination doesn't prolong your recovery time. So I think that's a question a lot of women have. Whether you have the breast done alone, the belly done alone, or the two procedures together, it's not additive as far as downtime. But getting back to exercising, I let you get back to a lot of non-impact things at 3 weeks. So Stairmaster, elliptical, walking on a treadmill, walking outside, spinning, cycling, swimming, all that in about 3 weeks. I'll let you even do some weightlifting. I don't let you do any core exercises or chest exercises or jumping, running, jogging, anything with impact I don't let you do for about 6 weeks. So that's kind of a nutshell. As far as time off from work, probably about 2 weeks, again, because of the tummy tuck more than the breast. So
Agreed.
that's the standard answer for the surgeon. And
yeah,
so.
No, I agree. I didn't push it. I didn't want to mess anything up. Like, I was so afraid. But I remember you telling me about something about not getting my heart rate up because of the swelling of the breast.
Right.
Something about that. That
Right.
was, so I was real cautious of
Right.
that.
I don't like people getting their heart rate up for the first 2 to 3 weeks, because everything that's been injured, you're more prone to get blood flow into that area. So when you get your heart rate up, we want the swelling to go down so you can get back to things much quicker. So as you're healing and you get your heart rate up, everything can swell back up again. Now you're sort of having to wait it out again. So you're just prolonging the inevitable.
Yeah.
So.
Yeah, I probably went back to work. Now I have a desk job. I'm office manager, and I mean, I didn't lift anything heavy or anything like that, but I probably want to work that next week. Sorry, I just sat. Okay, I meant 2 weeks. But I just did a lot of sitting, and I knew what was for my limit. Like, I knew when it was time, I had to go. I had to go home. I had to rest. I had had enough, because you are in that binder, and I think I still had one drain. Well,
Probably
of course, because you have 2 drains, and you can get those removed when there's, which you can explain better, when there's a certain amount of fluid. But I still had to keep one in for a little bit longer. And I was really upset about it.
Probably because you went back to work.
And I did. See, I did. I just gave myself away. I did. And so I was wearing like baggy clothes, and because you do have the binder, and then you're still binded. Yeah, you're binded up here. So I was like a hot mess at work, but I went and did my job, and I had no trouble. But again, I knew my limit. I knew when I had to sit, like get up or leave or go home, or I didn't push anything. I knew when it was time.
Yeah, and you do. You have to rest, and the more you rest the first couple of weeks, most ladies are back really feeling pretty good about 3 weeks.
The
energy
breasts were
level.
the easy. Like I could.
Yeah, breasts are easier to recover from.
What I would have been. It's the stomach.
After
that,
breasts by themselves, most women are back to work in about
absolutely,
5 or 6 days.
I could see that. Honestly, I can.
It's not hard.
Yeah.
Heather says hi.
Hi, Heather.
When you're talking about combo procedures, about breast and tummy, and then Michaeleen, you had mentioned liposuction. Is that something you can include in the mommy makeover all together? Is that typical?
Again, we have the ability to add or do whatever the lady really requires. So you can individualize these mommy makeovers, if you will, but any procedure, you can individualize it to what is bothering the lady, and it just depends on how they lose their baby weight and how the skin retracts. So like I said, it could be liposuction, and sometimes you carry a little bit more on the, a little bit of weight around the hips, and we can kind of tone that down a little bit with some liposuction as well. So
what's the upkeep after having a mommy makeover?
You know what? Getting ladies back to their normal activity, and as soon as I can do that, I get them back to normal activity. Get them over the hump. Get them back to their, if it's taking care of kids, getting them back to work, getting them back to exercise, and and it's a long-lasting procedure. So as long as you're out doing the things that you normally do, and you're maintaining a healthy diet, you're maintaining some type of level of exercise, those results should last a long time. If we do use an implant, and I prefer the silicone implants over the saline, the silicone implants last a good 20 to 30 years, probably closer to that mid 20 to 30 year range. And then they're going to have to be probably replaced at that time. So implants are not forever. So I think that's a little bit of maintenance that ladies need to know about.
I'm sorry, I actually have a question for you.
Yeah.
About that. Because of my age and having the implants now, and you said 20 to 30 years, so give or take a couple years, I'll be in my whatevers. And so, senior, obviously, a senior citizen, what do they do then? Do they...
That's a great question, because a lot of people ask that.
Get implants back in, or what do you do at that point?
At
Like,
that
can you
point-
imagine being 60-some-year-olds with, like,
Well,
turkeys?
yeah.
I mean,
Because,
I don't know.
at some point, we're all going to be there. So,
That would be, like, awesome and disturbing all at the same time.
No, I tell you what, here, and this is the honest truth. I'm replacing them on ladies in their early 70s, and most of those ladies are not really. They don't really have large implants in any way. But remember, that's now that lady's self-image, and that's her body image. So if the lady is in good shape, swapping out implants and exchanging them is a very quick operation.
Even at that age?
Oh yeah, it might take 30 minutes. I mean, it's pretty quick. So if she's in good shape and she wants to replace them, we can certainly replace them. If they get to a point where she's maybe not in good shape or she doesn't want them anymore, you can just remove them, and that's maybe 15, 20 minutes. It doesn't take long to remove them, but you'd be surprised. At some point, we're all going to be that age, and we're going to feel pretty good. And
that's right. I'm going for that second.
It always cracks me up, because we have two young ladies here with us tonight, and they're both millennials. So I always love when the young ladies come in and they want to talk about a breast augmentation, and I tell them the statistics. Okay, in 20 or 30 years, and they'll go, "Oh my gosh, I'll be in my 50s by then. I'll just probably won't care about it at that point." Wow, So you will care, but just so you know, even in late 60s and early 70s and mid 70s, if you're in good shape and you want to keep them, we just swap them out, and you just keep going.
There's a question from Dawn. Having had cancer, they tell you you're prone to strokes. Is there any reason you would not suggest having this done?
No, I don't. I mean, I don't think that's would be an issue. I think the biggest thing is, like Michaeleen was saying, as long as you're in good shape, physiologic shape, this operation is not going to make you more prone to having a stroke or coronary disease, or heart disease, or anything like that. So, I think that there are ways of optimizing a patient. People that are diabetic, you make sure that their blood sugars are under good control. There are lots of people that have high blood pressure. You just make sure that their blood pressure is under control. I go through a pretty good screening with people about their past medical history. And I talk to their primary care doctors. I'll talk to the cardiologist, their pulmonologist, and go over things with them. And if it's something that their other doctor doesn't think it's a good idea for them, then we don't do it. So I don't try to override anybody's specialists, but I think the surgeon and the doctors need to be on the same page, as well as with the patient. So Dawn, I don't think that none of the procedures that I do would really add to your risk of that. So if it's something you're contemplating, then I think by all means at least inquire about it if that's what you want, and then you can make up your own mind. And I think that's part of the consultation, is getting the information from the surgeon about the procedure. Then you can make up your own mind what you want to do.
I have a couple questions for you, Michaeleen.
Okay.
How about scarring? How do you feel about your scars?
They do not bother me. The breast scars, you can't even tell. Of course, the tummy tuck is a little larger. And you don't want to know what I tell people if they see it, and I tell them, and some people actually believe me at first. I tell them that I used to be a magician's assistant, and that the solid half went horribly wrong. It's really not bad at all, and it doesn't bother me at all. And I'm no spring chicken, so I don't walk around in the bikinis that are way down here anyway. So things that I wear cover that part anyhow. And,
right, and I think that's the concern. I have a lot of ladies that'll come in and they're thinking about a tummy tuck, but they don't want the length of that scar. What they don't realize is that that tummy tuck, you're coming because you want your belly contoured. Mm-hmm. And so I tell them, listen, the length of the scar shouldn't bother you. The contour of the finished product is what you're going after. So if I have to make an incision that's 6 inches long or 60 inches long, it's in an area that's low enough that should be covered by almost all the clothing that you want to wear, and we talk about that. But there's patients that have lost a lot of weight. I go all the way around, lift the buttocks, lift everything. So again, you want the contour because you want to look good in your clothes. You want to look good in a bikini. So the length of that incision has to be long enough to take out all the extra skin and not give you a bulge on the side, because then that really hasn't helped you. So classically, the incision extends down just above the pubic area all the way out to just inside your hips, and again low enough. So, but that usually makes a pretty nice flat surface.
I think the way you look and feel takes over what you feel about any scarring that you have. For me, any scarring that you have, and again, unless you're some sort of model or you do something like that for work where you need to be almost naked, it doesn't matter. Anyhow, you still look and feel great in clothing, and it's not an issue. So for me, anyhow.
You mentioned you have children. Did you have a conversation? Now your children are older.
They're older.
Did you have a conversation with them? Are you comfortable taking care of them after the mommy makeover?
Yeah, I didn't have too much taken care of. I would probably say if you have little ones, it may be a little harder for you, and you may need a little help. I guess particularly for those first 5 days, just because everything is so tight and fresh, and what we had talked about. But they knew I was having the surgery, obviously, because they knew I was going to be in recovery for a little bit, and I had drains, and so they think it's hysterical. They talk about my boobs all the time. Well, they think I look great, of course, and they're glad I did it, and I'm glad I did it to show not that I'm a superficial person, but to show my girls that, hey, there was something that bothered me. It was my time in life. I'm doing something for me. So, and that's what I did. Because moms never do anything for themselves. You know that. You girls will know that soon enough. You never do anything for yourself. Your family comes first. You do everything for them first. And it was financially, it was a good time for our family. I would never put our family in financial havoc. It was a good time, and I was like, let's go for it. I'm doing it. So I did it for myself. And then when you feel better, you're able to take care of your family better. Everybody, it just trickles on down. It's all around. So,
Yeah, that self-image is really powerful.
I mean, some people would say, you might hear a negative like, well, you're teaching your girls looks mean everything. No, it's how you feel about yourself. Do I care what anybody else thinks about me or what? How I feel. That's why I did it. It wasn't for my husband. Boobs weren't for, because a lot of the ladies will say, well, you're doing that for your husband. No, they were for me. It was for me. He could have cared less. He still cares less. but so I don't think that I taught my girls anything like negative, like, well, you're superficial. I can't believe you had surgery. I don't feel like that at all. I don't see how other people see it, but I mean, how do your patients? I
think that's the tone of most of the patients is, it's one thing that we do talk about quite frequently, and a lot of people use the vain word, and I tell them it's not really being vain, and again, to reiterate what you said, it is something for you, and your self-image is really emanates through your whole life and everybody that you touch. So, if we're really talking about being vain, we get up in the morning and first thing you do is you shower, you brush your hair, put on makeup, brush your teeth, you put on nice clothes. So all of that really is, if you really think about it, is if you want to label it as vain. So there's nothing wrong with putting your best self forward.
No, why wouldn't you want to make yourself feel better? You look better, you feel better, you function better, you're better for your family. I don't know. I just don't see. I'm not ashamed of my surgeries. If people ask me, I'd be glad to tell them about it. Although I still feel like some people are afraid to
ask you.
Yeah.
Yeah. Well, But I think the key thing in all of this, and anybody that's listening, and men thinking about something for them as well, you have to do it for yourself. Even if you're married, you have a significant other, you have to do it for yourself. It really doesn't, you can't do it for somebody else because you're the one actually going under the knife. You're the one that has to heal, spend the time. So do it for yourself, and that's when you get, that good feeling about it. And then that can emanate out to the rest of your family and everybody else that you come in contact with.
Absolutely.
My last question for the night, Michaeleen, is for you. What would you suggest to moms that are on the fence about having this procedure?
Well, as Dr. Antimarino would say, get off the fence. I would suggest, I go for it. What are your hesitations? There's really no down or bad side. I mean, you've got to do it at the right time for your family or your lifestyle. I mean, if you have a job that you can't take any time off, well, then that can see that being a problem, of course. You've got to do it at the right time, but if it's financial reasons, charge it, baby.
Well,
no, honestly, there are options. I'm joking. There are options. There's care credit and things that. I mean, there are options. You make it work. You want a new car? Same thing. It's a large purchase. You're going to buy your new car, right? Well, this is investing in yourself. So you may see it's a large purchase, but just make it work. It's payments every month on whatever. I think when I was discussing that financial options with Chanel, she said there were patients that came in and handed her 5 different credit cards. But if that's what they had to do, they were doing something for themselves. That's what happens. But I would say definitely get off the fence.
Right. And I would just reiterate or add to that and saying that, if you're even thinking about it, having a consultation has no obligation. You don't have to do anything, but sometimes people don't do anything because they don't know enough about it to make the right decision. So, and as you're a great example, you came in the first time, it wasn't the right time, and in life, timing is everything. So if it's not the right time, at least you have the idea, you know what it's about, you can ask all the questions you want of the surgeon, kind of get in your head, and then look at the timing. And I see patients all the time that, that ask me, when's a good time to do the surgery? When you have the time to give
when it
me
works with
for
your
the downtime.
family,
Right, and so that's paramount. Do it the time that's good for you, not the time that's good for the surgeon. And it might be 3 or 4 years later.
Right,
it
I
could
agree.
be 3 to 4 days later. It depends on you. But just finding out the information can sometimes allow you to make a better decision.
I definitely would go for the consult. Even if you think I can't, right now it's not I would definitely go for the consult, because then that's going to nudge you a little bit so you can see what your options are, what exactly can be done, what you want done. I mean, I added the liposuction. That wasn't originally that, when you might go in and surprise yourself and say, yeah, I kind of want that done too. You might as well throw it all in there and
you might
just
also
do it.
recognize that it's going to take more than what you originally thought, and this might be not.
I would definitely, at least that's the first step, is to have the consult, because you just don't know where you're going to go from there. Everything else will follow in order. You can figure it out. You can plan it out. You can get family help, but I would definitely go for the consult. So get off the fence.
All right, well, listen, thank you so much. Thank you to Michaeleen for
Thank
coming
you.
in and hanging out with me. So this was great. We have to do this again. So it's always nice to share the spotlight.
I have to get more
Talking.
procedures.
But listen, thank you again for tuning in. I hope we answered all of your questions. Next month we have another live Facebook event planned. I'm only going to give you parts of it, but it's Pam and I are going to be talking about some really new procedures the both of us will be doing with dermal fillers, and I think it'll blow you away. So things that she and I have been working on, and we're going to come back to you, and I think we'll offer things that you won't see anywhere around here. All right, so if you have any other questions, let me know. You can see us on our Facebook and also our website, www.bellissimoplasticsurgery.com. And happy Mother's Day to all the moms, because we'll come in after that.